In the first discussion, in the first summits, we focused on early detection, diagnosis, and treatment in that systematic approach. This summit is different because we're looking at the questions of healthcare delivery. And so what you're going to see over the next 3 days is a turning that agenda on its side. And instead of talking about early detection, diagnosis, and treatment, we're going to focus on resources. Today, the focus will be on low-resource countries, Africa being an example, but of course there are low resources throughout the globe, including in my own country in areas of underserved populations. The second day will be focused on middle resource countries, and Latin America. Our partners from SLACOM and multiple Latin American countries will help us understand that actually the problems are somewhat different in that setting, and the key solutions are not identical to what one does in a low-income setting. Day 3 is problem solving. Day 3, we're going to focus on how do we bring this together in ways with practical solutions that can be tested in a real-world environment. Each one of these days will have a consensus article that will be put together. It is the speakers and moderators that will be heading each of these 3 manuscripts that will be submitted to Lancet Oncology. I'm going to also mention that for our individual speakers and as well as our poster presenters, we are, as a second project, going to put together a breast supplement for the journal Breast, the Elsevier publication, Alberto Costa editor. And so that what we would like to invite people as you're presenting material, if you think you have a manuscript that may be considered for publication, please, Sandra Disseldorf, who's right here, Sandra, if you could raise your hand. Sandra will be receiving these, and what we'll be doing is going through this and identifying probably about 10 manuscripts. Now, we're going to start our first morning session, but before we do that, we have questions that we would like to poll the audience. Everyone should have one of these handheld devices, this response innovation card. And the idea here is that we're going to ask 1 or 2 questions at the beginning of each session so that we can get an understanding of how does the audience perceive some of the issues that face us. We're going to ask the same questions at the conclusion of our discussion to see if we have different conclusions. So our first question is, do you believe that cobalt radiotherapy, A, is an outmoded therapeutic modality, B, is an appropriate tool for use in low-resource settings, or C, should be used only when linear accelerators are unavailable? So if you push on your device either A, B, or C, we will see what our group says. And which one do I click on? Oh, yes. Yep. Okay, 3, 2, 1. There. So 47% thinks that it should only be used in when linear accelerators are unavailable. A similar group thinks it's appropriate for low resource settings, and actually only 8% thought that it's an outmoded therapeutic modality. We do have one other question. Cytotoxic chemotherapy for breast cancer, A, should not be provided in the absence of trained medical oncologists. B, can be provided in limited resource settings by general clinicians. C, is unnecessary in most low-resource scenarios due to advanced stage disease. Very good. 3, 2, 1. So the great majority thinks that it can be provided in limited resource settings by general clinicians. This is excellent to know. What I'd like to do now is introduce our 2 panel co-chairs and for this morning session. And we have Dr. Naji El-Sagir. He's a medical oncologist from Lebanon, clinical associate professor in the Division of Hematology Oncology at American University of Beirut. And Dr. Clement Adebamawo. And Clement is professor of surgery and the director of the Institute for Advanced Medical Research and Training of the West African Centers for Bioethics in the University of Ibadan, Nigeria. Now, the job of our co-chairs, gentlemen, if you two could come up, we've really packed this session in, and so the job of the moderators is to keep us on time. So, speakers, I'm going to ask you to please confine your discussion at a most 20 minutes, preferably 15, because this will allow more discussion time. And the gentlemen are authorized to come and get the hook if we all talk too long. So, without further ado.